And guys, we are back with our weekly live session with a specialist doctor to take care of your concerns. So today we are going to be joined by a very specialist doctor. Her name is Dr. Berenice Stella. She's an ENT surgeon. And guys who are having the sinus issues, headaches due to sinus, this particular session is for you. If you have got any question around sinus, please do not hesitate to ask us. Mention your questions in the comment section below, and we will try to take them up during this week's live session. At Cureka, as usual, we try our best to give you the best of products in skincare, hair care, elderly care, pain management, baby care, maternity care, sexual wellness categories. We have got more than 8,000 products, and these products have been carefully handpicked by a team of expert doctors led by Dr. Hema Satish, who is a founder of the company and a dermatosurgeon, as well as Dr. Satish Devdas, who is an orthopedic surgeon and the co-founder of the company. Their team carefully handpicks these products and make sure that you get the best of the products at the most affordable prices. So we ensure that we purchase these products directly from the manufacturers and present them to you. I mean, in market these days you will find many organizations online who are offering you some kind of a healthcare products. But you have to understand these products are not coming from those companies. These products are coming from the sellers of those companies. And the sellers are not experts. They are just traders. We as a company, we make sure we have got very strict quality policies because we are a company which is run by a team of doctors. They also, by the way, have multiple hospitals as well. In a small town in Madurai, which is located in south of Tamil Nadu. So guys, we are here to take care of you. Give us a chance, give us an opportunity to serve you. There is a free of cost WhatsApp platform that you can use to ask questions to us. Any questions around your healthcare, around your family, your brother, sister, husband, wife, parents, grandparents, your friends, and let us know how we can help you. This WhatsApp platform is completely free of cost, no charge whatsoever, no obligation that you need to buy from us. You can ask as many questions as you want, and we will be more than happy to serve you. So, without taking much of your time, let me welcome today Dr. Berenice Stella. Dr. Stella, welcome. Thank you so much for joining us today. Doctor, can you hear me? Am I audible to you? Hello.
Hi. Yeah, now I can hear you. Hi, good morning.
Great. Good morning, doctor. Yes. So, doctor, the topic for today for us is exploring the causes, symptoms, and effective remedies for headaches that are associated with sinus issues. So, because you are an ENT surgeon, a very basic question comes to my mind right now. How many such issues do you see every single day? How many cases for sinus come to you for, usually? What is the periodicity of these cases coming to you, doctor? Are they very frequent?
So, before we start about the sinus topic, I just wanted to correct a small part of your introduction.
Sure.
With Cureka. So, Madurai is not a small town, it's a big city.
Yeah.
Proud to be here.
Yes,
So,
yes,
yeah,
yes.
That's
yes.
on a funny note. So,
Yes.
about sinuses. So, a small word about sinuses. Sinuses are air pockets which are within our skull. So, the skull is a very heavy bone compared to the other bones. So, it's very difficult for us to carry the skull in our with only a small neck. So, that's why God has put into 8 small pockets of air so that we make the skull lighter and more easy and friendly to carry. So, those are sinuses basically. And when you talk about the incidence of how many sinus cases that I see in a day, around 40% of my outpatient and inpatient attendance per day is pertaining to sinus headaches and diseases in sinuses. So it is quite a common condition nowadays, I would say.
Mhm. Okay, so guys, that means a lot of people or friends or family members amongst you might be having these issues. Please hook on to this particular session. Stay till the end, and you will find answers to a lot of your queries. If you have got any question, as usual, please do in the comment section below. So, doctor, can you please share some light on some of the most common triggers for sinus headaches? Should viewers be mindful of in their day-to-day lives?
So, sinus headaches, as more we call it as sinusitis, that usually gets triggered by any respiratory infections, just like how we get a flu or any respiratory infection where we, commonly called as common cold, that can aggravate a sinus headache in a normal person. And
Yeah. Okay, so we are finding some network issues with Dr. Stella.
in an allergy prone
Yeah,
person, even a contact, most common cause would be infections
yeah. Okay.
and allergies and any
Hmm.
polyps in the sinus.
Okay. Okay. Now, doctor, sinus issues can vary in severity, right? In your expert opinion, when should someone seek medical advice for their sinus problem?
Okay, so that is actually a timeline. So when you have on and off headaches, which is
Hmm.
lasting for more than 3 weeks,
Hmm.
then you should actually go to a consultant, a specialist, get yourself checked by means of an endoscopy or a CT scan of the sinuses would be better. But if you say I get once in a while, like once or twice in a year, then it is nothing to worry because usually when the sinus gets some fluid inside, we start having pain. And then when we do some home remedies, it will get resolved. So no need to visit a doctor for that. But if your symptoms are persistent and they are becoming more and more progressively severe, and they are for more than 3 weeks, and I would say you should get help from a specialist, either by doing an endoscopy through the nose or doing a CT scan.
Okay. Doctor, distinguishing between a sinus headache and tension headache can be very tricky these days. Could you share some key differentiators and tips for accurate self diagnosis?
Yeah, that is a very interesting question because it's a totally different entity. It's a totally different thing. Sinus headaches are purely from the mechanical blockade of the sinus pockets that I was telling about earlier. And they have symptoms like immediately after taking bath or after sweating profusely, maybe after a heavy workout where you sweat a lot in your scalp. Following that, you have this headache, and when you look down, you have heaviness, and especially there is pain here. So, all these symptoms are classically because of sinusitis. But on the other hand, tension headache is like a global headache. We call it as a ring headache. It comes mostly around the whole head. Following when you're very anxious, you're stressed out, tense, maybe you're shouting at someone, or you had a sleepless couple of nights, then that is all because of tension headache. So that is neurological. The nerves are involved in that. For that, you have to consult a general physician or a neurologist, maybe. But if it is the symptoms are heaviness of the head following head bath, or when you look down, you feel like as if the face is looking weighing down. Those are all sinus related headaches, and for that, you should actually consult an ENT specialist to sort it out.
Right. Understood, doctor. Doctor, natural remedies are often sought after for sinus relief. Could you recommend some effective natural approaches that viewers can consider?
Sinusitis is one of the problem that has a perfect natural remedy, which will be told by all the doctors. I would say, and even most of the general public will know what that is. It is steam inhalation. So, as I said, there are a lot of air pockets. For example, we have two big air pockets here, which are big. They are big, but then they come to the nose with a small opening. So the problem is with the opening. The sinus is big and the opening is small. So when you have sinusitis, what happens is the blockage becomes even more smaller. So there is no ventilation for the sinus, and the building pressure within the sinus gives us the headache. So what you have to do is you make the opening patent, and that can be achieved with steam inhalation. The moment you take warm hot steam through the nose and the mouth, the opening gets little bigger and it just relaxes and lets the air inside go in and out. So that actually relieves the sinus headache. That's the basis behind why we have to take steam inhalation.
Right. Doctor, lifestyle adjustments can play a significant role in managing sinus headaches. What are some practical changes individuals can make to reduce the frequency of these headaches?
So, for example, if a person is already prone for sinus headache, then such kind of people should avoid frequent hair wash, or even if they are washing their hair, it is advisable to dry it as early as possible immediately after the wash, and let not be the scalp damp for a long time. Preferably by using a hair dryer or a blower or something, so that the hair is dry immediately. And even if they're going for an outing or they're going for some trip where they have water body where they have to swim for a long time, I would say they have to reduce all that. So these are the changes that have to be done. And if the patient is also allergic to the dust and everything, which triggers the sinus headaches, better to advise avoid the dust exposure by wearing mask when they go out in windy and dusty environments. That's all.
Right, right. Doctor, we have a question coming in from a listener. His name is William. William is asking us, can you please share some tips to avoid sinus headaches in breastfeeding mother?
So when we talk about breastfeeding mother, they are the sensitive crowd of people where they cannot take many severe or worse or bigger antibiotics. They can take maybe paracetamol for pain, or the very mild group of antibiotics like amoxicillin. That because everything goes into the bloodstream and eventually gets into the milk and the baby drinks it. So I would say home remedies are the best when you have sinusitis, when you are lactating. But if it crosses a certain level, because I know immediately after the delivery and you're breastfeeding, your life takes a toll and your sleep cycle goes for a toll. So sinusitis can get triggered even more. If you think that it is getting resolved with paracetamol, once in a while with a lot of stimulation, maybe thrice daily for around 10 minutes with only hot water, not with any other medication or anything. If it is coming down, then it's all right. But if you feel no, it is not leaving you and it's there for more than 3 weeks, better to get a help of a doctor, get seen and sort it out.
Right, right, right. That's I'm sure a lot of help to William. I believe we are able to answer your question. If you have got any question, guys, please do mention in the comment section below, and we will try to take them up during this call. So thank you, Dr. Stella, for answering that. And Doctor, while we seek relief from sinus headaches, is there a possibility of achieving a permanent solution for chronic sufferers? What are the options available?
So when we say chronic, we actually mean that it is more than 3 weeks or is it more than 3 months. So many patients I see have come with a sinus headache history lasting for 10-15 years. And they will think, okay, it is just a headache, maybe it will get resolved with on and off medicines and this thing. But when you think the problem is there for more than 3 months, better to get an endoscopy done. Because the sinus is just like any other organ in our body, better to actually see what is there inside, even if something else growing inside, like a polyp, which has to be removed endoscopically, or in a very rare case scenario, tumors can also grow within the sinuses. I'm not scared to, I'm not scaring the viewers, but always there is an option that rare things.
You should always be on the safe side. I mean, that is what, doctor, you were trying to say. Understood. Yeah. So there is an internet lag at doctor's end. This should be back, basically. So doctor is explaining us about a permanent solution for chronic sufferers of sinus, and she's recommending us endoscopy. Yeah, doctor, can you hear me now?
I'm kind of having a trouble hearing you, even though I'm fully connected. I'm sorry, what is happening? I'm not sure.
No, no, that's quite okay. We can take a pause here and probably get the network issues solved at your end, and then we can get it done. Not a problem, guys. So we'll take a short 10-second break until this
Sure.
network issue is resolved. Yeah. So, guys, now for Dr. Stella has been helping us with understanding the sinus issues. This is a very common issue with a lot of people today. Because of that, they're not able to work properly, lead a normal life. You have got any suggestions for us, anything that you would like to point out, please do mention them in the comment section below, and this will help us, majorly all of the viewers at large. Share something that your doctor has recommended to you, or some products that you have been using to avoid sinus. Doctor has shared a wonderful thing that you can use, which is a steam inhaler. Steam can definitely help you open your pores. So, doctor, are you back? Can you hear us now?
Yeah, I can hear you.
Okay, great, wonderful. Yeah. Great. So let's try to have this answer again, for because our listeners want to understand what is the permanent solution for chronic sufferers. Can you please share that again? Yeah.
Okay, so when we say permanent, it is more than 3 months of duration, and anything for a permanent problem has to be evaluated to the level of doing an endoscopy to see what is there inside the sinus. Sometimes there can be only polyps. Polyps are which, because of chronic infection, we can have fluid-filled balloon-like masses within the sinus. They are totally not scary, and but they have to be removed with an endoscopic sinus surgery. So that is one. The other thing the chronic sinus people can have, if they are elderly, and if there is a genetic association also, there can also be a tumor sitting inside, which we will be thinking that it is only sinusitis, but it is seen or proven unless otherwise with the CT scan. So I would always advise, if you are having a trouble in the sinus for more than 3 months, please visit your ENT doctor to do an endoscopy. If it is not seen clearly through the endoscopy, then better to get a imaging, which is a CT of the PNS, paranasal sinuses. That's what we call, maybe of the face, to know what is inside. Then treat it early than later.
Understood, doctor. So, doctor, the idea of spicy foods clearing sinuses is very intriguing. A lot of people are trying that remedy. Actually, I don't know whether that is a remedy. Could you explain how this works and if it's a viable method for sinus relief?
Even that question is very amusing to me also. I'm hearing it for the first time.
Oh, is it?
So
Okay.
what happens when we eat a lot of spicy food is, there is a lot of small glands in our mouth, our nose, and within our sinuses. They all get triggered. They become very active, and they start pouring out a lot of secretions. So that is why we just have a lot of water running from our nose when we eat a lot of chilies. So I don't think that is giving any relief either. And spicy foods does not give any relief, or it does not trigger the sinuses. But on the other hand, the other kind of headache, which is usually confused with sinus headaches, are migraine. So this migraine gets triggered by spicy food intake in quite a lot of people. So I don't want people to confuse the sinus headache and the migraine headache with the spiciness.
Yeah. Okay. Doctor, could you guide us on what's when it's essential for individuals to consult a healthcare professional for their sinus-related headaches? What are the red flags that we should watch out for?
So yeah, it is a very good question, which most of the people should know. First is the duration. If it is for more than 3 weeks, then they have to consult a doctor. And if they have severe pain here in the cheeks, both the cheeks, or sometimes they can have numbness over this cheek, that when they can also have pain behind the eye along with the sinus headache, and they can have persistent nasal obstruction. which indirectly says that there is something growing within the sinus which is not letting us breathe properly. So nasal obstruction, and worst comes worst if there is bleeding from the nose. All these are red flags for sinus related issues to be seen by a doctor as early as possible.
Understood, doctor. So, I am sure that is very helpful for a lot of people because they would like to know in advance when they should consult a healthcare
Yeah.
professional. Now, diet plays a crucial role in the overall health. Are there any specific foods that can trigger sinus headaches, and how can one adapt to their diet to mitigate these effects of certain foods?
So the mechanism of headache, just like I said earlier, big sinuses all over our face, but they have very small opening. So when we eat, like for example, a person is allergic to some food and then they eat that food, what happens is the inner lining of our nose, our mouth, and everything, they start swelling. They become big. So once they become big, the ventilation in and out of the sinus is blocked. So that can happen, and some people who are not very frequently eating all chilled items, and they have this allergy and they consume a lot of chilled food, again the same thing happens. The opening gets blocked temporarily because of the excessive chillness, and then they can have headaches, but those are not very common causes. As far as I know, sinus headaches are triggered mostly because of the common cold and infections and allergies rather than the food intake.
Understood. So there are not many particular specific foods that
Yeah.
can trigger sinus headaches. Understood. So over-the-counter medications can provide some kind of a relief, doctor. Are there any particular type of ingredients that our listeners should look for when selecting remedies for their sinus headaches?
Yes, usually over the counter is not a good idea for anything, but when it is sinusitis, the perfect combination to be done at home in the initial days are take a good a hot or warm steam inhalation, and then take paracetamol if you are not a heavy person, maybe around 500 milligrams once or twice a day for at least 2 days. If you think the pain is gone with these two, then I would not advise you to go to a doctor. But beyond paracetamol, there is no other over-the-counter medicine that the patient can self-meditate on. So you have to consult a doctor because there are a lot of bacteria, and there is a mixture of bacteria that can cause sinusitis. So we have to find out which one that is and give that particular drug to the patient. So over the counter is only paracetamol, I would say, based on your weight.
Understood, doctor. And that's a very fair thing to say. Okay. Now, doctor, steam inhalation is a traditional practice for sinus relief. Can you explain the science behind it, and you can share some tips for effective steam inhalation because a lot of people do not know how to take steam as well.
So, steam inhalation, uh, there are different ways. I would just start with the traditional way where you boil the water in a wide mouthed vessel, and when the water is boiling, when the water is boiling, you just stop it and take it to wherever you are. You cover yourself with the blanket and inhale the steam because it is going to be all over inside the blanket. That is one. And the other is nowadays we get a lot of vaporizers,
Yeah.
and you can also use that. Just pour some water, switch on, and then you can inhale the steam wherever you are, even with or without a blanket. So that is one. And the most important thing where I have seen from so many patients is they usually instill a lot of things in that water when it is boiling to take the steam. For example, turmeric and menthol, like menthol preparations like Vicks or Amurtanjan or some eucalyptus oil, or there's a medicine, green pepper and carbon plus. So I would say they don't have much of an effect.
Oh,
So
is it?
yes, they in fact they irritate your sensitive skin of your nose. So and they don't give a permanent relief. It is just that you feel the burningness of it better temporarily, and that's not going to give you any relief. So the best thing is plain water, 10 minutes boiling water, 10 minutes good steam through your mouth and the nose is the best steam inhalation rather than putting anything inside is not that of a great idea.
Wonderful. I'm sure you're shattering a lot of myths, doctor. right now, because a lot of people,
I know.
including some family members of mine, also they put a lot of menthol while they're trying to inhale. That's very important to understand. Now, allergy seasons can be challenging, doctor, for the sinus sufferers. So, what proactive steps can individuals take during these allergy seasons to manage their sinus headaches?
So when we talk about allergy and sinusitis combination, allergy, if it is dust allergy, then definitely you have to wear a mask, preferably a cloth mask, a single layered one, so that you avoid the dust exposure. And if you're allergic to certain food, or maybe you have the seasonal allergy, wherein during December or during the pollen season you sneeze a lot and then you get sinusitis, you can take certain nasal sprays or drugs during that time to avoid you from certain allergy sneezing episodes, so that it does not progress you to sinusitis. So I would say wearing a mask and covering your eyes with glasses, because the dust enters through the eyes and the mouth and trigger your nose. So that is one prevention. Or if you think no, nothing can prevent me, I'm a very bad allergy during seasonal thing, then please consult your doctor. There are prophylactic medications and sprays that can be started temporarily for a 2 to 3 period, 3 month time, which will put you out of allergy and in sinusitis also.
Wonderful. And doctor, there is also like people think that massages are known to alleviate various types of headaches. Could you recommend some specific massage techniques or pressure points that may offer relief from sinus headaches?
So this question is super interesting and super controversial. There is no massage technique that can relieve sinusitis, and I would advise the patients or the people who are hearing this, please do not attempt any massage, because there are important nerves. For example, the most common pain comes here. So there is a nerve called as infraorbital nerve, which goes in this way into the eye, and that is very important for the sensations in our cheek. So the moment you do sinus massage here, you can actually damage or press the nerve, thereby causing numbness here for a quite a long time. So massages do not cause any relief in sinusitis. As I said earlier, the whole pathology remains within the bone. So none of your massage can reach within the bone unless you break the bone and go inside. So massages can maybe help with our temporary pain relief, like when you're having a severe pain, maybe little warm compress over your face here and here. Warm compresses can help, but not too much of your pressure there. It is not very good. As I said, there are very important nerves crossing around the eyes and on the cheek, supplying our our mouth, which is
Yeah.
important to for us to smile properly. So let's not damage all those nerves by doing massages. I know it's a
Right.
very controversial answer, but this is the basis behind that.
Right, right. So, guys, just take care of this thing. Dr. Stella is emphasizing there is no such massage that can help you. Only you can do some warm compressing. So, stress is also a common trigger for a lot of headaches. How does it relate to sinus headaches? And what relaxation techniques can individuals adopt, doctor, to reduce stress induced headaches?
So, stress-induced headaches are there only in tension headaches and migraines. Stress headaches will not come in sinus headaches. As I said, sinus requires a mechanical obstruction of the sinus opening, which is because of infection, allergy, or any water entry or anything like that. And stress is directly related to tension headache, most importantly, migraine. So such headaches are a different mechanism of action, and the nerves are involved in that, and their medications are completely different. And even though migraine is also dealt by ENT doctors, I would suggest kind of headaches, it is better to consult a neurologist and get a medication for that. So stress and sinusitis, they are not very directly related.
Understood, doctor. So, doctor, that brings us to the end of today's session. Any advice you would like to give it to people who are suffering from sinus to give them some quick relief, something they can do to bring some relief to them?
Yeah. So usually the timeline is like this. They start having allergies when they are in their adolescence or late childhood. They keep sneezing whenever they come into contact with the dust, but then they'll just keep avoiding it. I'll just sneeze 10 times and then I'm all right. So what happens? Such allergy creates a lot of irreversible problems in our nose. eventually blocking the sinuses, and that's how most of the people come with sinusitis. When you look back and take the history properly, they would have been sufferers of allergy since childhood, which were really not seen properly. So I would advise, when you have this sneezing, like somebody sneezes for 10-15 times as soon as they wake up, or when they go out in the road and then there is a gush of wind in their face and then they sneeze 10 times, which means the person is suffering from allergy. Please get a consultation from an ENT doctor and sort out your allergy before it is too late and getting into your sinuses, causing a lot of irreversible problems like polyps in the sinuses, which have to be treated surgically. So the picking up the early signs, and if you say maybe you have sinusitis after taking bath, and when you go to a waterfalls and jump in the water nicely, then you come back with a headache. Such headaches can be dealt with only steam inhalation and paracetamol. If you think it is lingering there for more than 3 weeks, again, please consult your doctor and sort it out.
Right, right. I'm sure that is quite helpful for all our listeners. Guys, it has been a wonderful session from Dr. Berenice Stella. She has been super helpful to us to give us all these insights. So much thank you to you, ma'am. And we wish you a very, very happy weekend. And we do look forward to getting more insights from you for many more important topics in the
Yeah,
future. So thank you so much. And guys, wish you a very, very happy weekend. Stay healthy and do give us a chance to serve you. Do browse through Cureka.com. And we hope that we'll be able to live up to your expectations. Thank you. Thank you,
thank
doctor.
you, thank you.
Thank you so much.